Day 6 na po tayo sa body fluids. Because blood and body fluids come from same source and mutually nourish each other, sweating and bleeding treatment methods are contradictory in practice and should never be used together. If patient is bleeding, one should not induce sweating. While if patient is sweating, bleeding as treatment method is contraindicated. If there is profuse bleeding, do not cause sweating. If there is profuse sweating, do not cause bleeding. This is because sweating causes loss of fluids. And as we all know, body fluids and blood are blended together and they are closely related to each other. Now, if body fluids is deficient, eventually blood also becomes deficient. So in a patient with severe deficiency of blood, do not cause sweating. Okay po? Pathology of blood fluids. Body fluids can be pathologically altered in two different ways. Deficiency of body fluids and accumulation of body fluids in the form of edema, dampness, or phlegm. Now let's go to our patient. Female, 36 years old. Tongue description, red, so it indicates heat. Red points at the sides, liver heat, and then dry and rough coating indicates deficiency due to heat. Okay, now let's correlate this this tongue description with the symptoms. Shortened menstrual cycle, which is a manifestation of blood deficiency. Then extremely profuse menstrual bleeding, very red menstrual blood. So there is heat in the blood. And hot flashes, we know that hot flashes is one of the symptoms of kidney deficiency, and irritability before onset of menstruation, and depression sa liver po yan, okay? Then, Western diagnosis, we have primary infertility. Background to disease, unhappy marriage, frustration, suppressed anger. So liver na liver po, and then excessive intake of coffee. So there is really presence of heat because coffee has hot in nature, okay? Now, TCM diagnosis, kidney deficiency, heat in the liver, and injury to fluids due to heat. Okay po? Then, another second patient, we have female, 34 years old. Tongue description, again, red, there is heat, and then thin, cracked body shape indicates deficiency. So there is deficiency, and then coating without root, deficiency pa rin. Then symptoms, severe exhaustion, inner restlessness, sore throat, numbness of left thigh, frequent dizzy spells, and occasional night sweats. So there is deficiency. There is heat due to yin deficiency. Okay? So Western diagnosis, multiple sclerosis, chronic tonsillitis, blindness due to optic nerve, and atrophy of left eye. Background to disease, irregular eating habits, frequent bouts of influenza, and long-standing emotional problems. So TCM diagnosis, we have blood and kidney deficiency, and stomach and kidney deficiency. Next patient, we have a male, 38 years old. Tongue description, red, slightly thin, cracked, coating without root, and red tip. So kung may red tip is an indication of heart heat or heat in the heart. And slightly thin crack coating, that is an indication of blood or body fluids deficiency. Then red, hot, okay? Symptoms are severe exhaustion, depression, lacking self-worth, and night sweats. So night sweats, alam na po natin kung ano ang indication ng night sweats. So it is kidney and deficiency and sore throat. Western diagnosis, chronic tonsillitis. Background to disease, long-standing emotional problems since childhood, suppressed anger, so, and overwork. DCM diagnosis, we have kidney and deficiency, fluids and kidney and deficiency, and hits in the heart. This is due to long-standing emotional problems because all emotions affects the heart. Okay, pa? And the last patient is female, 40 years old. Tongue description, deep red, so, and no coating, so deficiency with empty heat. Symptoms, severe long-lasting menstrual bleeding, dark red, strong-smelling menstrual blood, insomnia, and inner restlessness. Western diagnosis, none. Background to disease, deep frustration with life, excessive consumption of meat and spicy fried foods. So there is really presence of heat. That's all. TCM diagnosis, we have kidney yin deficiency and heat in the blood and fluid deficiency. Okay.